Yeah. So, welcome. I am Dr. Ruchita Kuba. I am Director, School of Health Sciences, and I am also your program coordinator for this very prestigious program, that is PG Certificate in Medical Management of CBRNA Disasters. So, we have a very small group just now. I think what we can do is we can quickly, I think, though you have written, but we can quickly take a small introductory session. Is it okay? Dr. Ashok and Dr. Ramesh, you can go ahead. So I'll call out your names and I think you can just introduce yourself. So Anupam to Teja, Dr. Anupam.
Yes, good afternoon, ma'am.
Yeah, please introduce yourself.
Ma'am, I'm in the Army Medical Corps
Okay,
and I've earlier done a PG diploma in hospital health management long
okay.
back, about 25 years back.
But now you've
So,
come as a sponsored candidate.
yes, ma'am.
And where are you posted?
I'm in Jalandhar presently, ma'am.
Okay, welcome.
Thank you.
Milind Soni.
Hi, good afternoon, ma'am. I'm Dr. Milind Soni,
Okay.
presently working with Reliance Industries Vadodara since last 5 years.
Okay. But you have come on your own. You haven't been sponsored or you have been
Yes,
sponsored.
ma'am. I am come on my own.
Okay. Okay, but Reliance was planning to sponsor. I mean, they could have sponsored you also, but it's nice to have you on board. Welcome.
Thank you, ma'am.
Kotor?
Good afternoon, ma'am.
Good afternoon.
Ma'am, I'm Lieutenant Colonel Kothur, ma'am. Currently posted in Ladakh.
Ladakh.
Yes.
Okay, that's nice. I hope you will get the connectivity, when we will be having the online classes. So do remain in contact
Uh,
with us because sometimes, connectivity may be an issue, but we'll try to help you out with any problems
okay,
that
ma'am.
you're facing. Okay? Okay.
Ma'am, thank you so much.
Well, no, welcome. Dr. Sonali?
Good afternoon, ma'am. I'm also a serving armed forces officer, and currently, this is my first experience with an online course. Really,
Okay,
last time,
it's not exactly an online course,
yeah.
but a distance learning course. Yeah, okay, no problem. So, where are you posted?
Currently, I'm in Delhi, ma'am.
Okay, that's very nice. So no problems. Any place we'll do the hand holding.
Thank you.
Okay. So then we have 1 second. Uh, Aman, Aman Arya. Hello. We're not able to hear you. Can you please repeat?
Good afternoon, ma'am. Can you hear me?
Yeah, but very low. Volume is very low. Maybe you need to come near the mic.
Ma'am, I'm currently posted in ma'am Air Force Station Srinagar, ma'am. I'm working as a medical officer there.
Okay. Welcome. We also hope that you will not have internet connectivity issues there. I hope so that
I
you.
hope, ma'am. I hope so. The same.
Okay.
Good enough.
Then we will be making a WhatsApp group also for all of you. We'll share the link with all of you through the email soon. Okay. Dr. Anupam, oh, you've already spoken. Yeah. Then we have Dr. Kulvinder. You are not unmuted, I think. Are you speaking? Yes.
Hello.
Yes.
Good afternoon, ma'am. I'm Colonel Kulinder Singh Judge. I'm posted at the AMC Center and College at Lucknow.
Lucknow.
Yeah.
Okay. Very nice. Thank you. Welcome.
And,
Then we have Dr. Madhur. Oh, Dr. Madhur has also joined. That's very nice. Dr. Madhur is our program in charge at NIMS Hyderabad.
Good afternoon, everybody, ma'am. Good
Good,
afternoon, ma'am.
good afternoon. Nice to see you joining.
Hope to
Doctor,
see some
yeah,
of them in Hyderabad.
yeah. Dr. Milind.
Actually, I have already introduced myself.
You have, sorry, because I'm now going through the other this thing. Dr. Neeraj.
No problem.
Good afternoon, ma'am.
Yeah.
I'm
Good
Dr.
afternoon.
Neeraj. I'm currently working in a government child hospital in Noida. I have worked in the industrial sector also earlier.
Okay. So, are you an occupational health specialist?
So I'm not a specialist. I have just 1 year experience working in industrial sector. So
Okay, that's nice. You're not a sponsored candidate, isn't it?
no, I'm not a sponsor.
Okay, that's nice. Smita, are you a doctor or are you from regional center? Dr. Smita Singh? We're not able to hear you, Smita. Hello. You are unmute, but we can't hear you. Maybe some connectivity issue is there. Okay, maybe when you get a little better connection, you can join. Dr. Sonali?
I introduced myself, ma'am, if you remember a short while ago.
Yeah, sure. Dr. Umar?
Hello, good
Yeah.
afternoon, ma'am.
Good afternoon.
My name is Dr. Umar Farooq. I'm an MD in internal medicine and I'm currently working in Assam at a medical college.
Okay, very good. Dr. Venkatesh?
Good afternoon, ma'am, and to all the participants here. I'm presently in Jodhpur. I'm a preventive medicine specialist, and yeah, I have some experience with nuclear medicine. So
That's nice. Are you in the medical college or are you doing free? I mean,
no, I'm in the army. I'm in the army.
You're in the army. Okay, very nice. Dr. Vinayak?
Good afternoon, ma'am. I'm Captain Vinayak Parekh. I'm currently posted in Manipur in Secondate Gorkha Rifle. This is my first experience at degree certificate, ma'am.
Okay, welcome. I
Thank you,
also
ma'am.
hope for internet connectivity with you.
Yes, ma'am. Definitely, ma'am.
Could be issues. Okay, Dr. Vishnu?
Good afternoon, madam.
Yeah,
I
good
am
afternoon.
Colonel Rajiv Mishra. I am posted in Jabalpur, MBA area headquarters. I have done MBA in hospital Adam,
Okay.
and I have done PG diploma in accreditation and quality management.
Okay.
I am an internal accessor for NQAS program.
Okay. So you are also in the armed forces?
Yes, madam. Yes.
Okay. You also
I'm in Army Medical Corps. I'm posted in medical branch headquarter MB area, that is in Jabalpur.
Yes. Okay, welcome. Very nice. Very nice. We are also having a recently last year we joined an MBA in healthcare and hospital management program from IGNOU. Currently, we are having around 900 students. So it's nice to have you there. Maybe
Thank you,
we'll
madam. Thank you.
involve you as one of our counselors or somewhere for as part of faculty for that program. Yeah, so you can be in touch with us. Okay.
Thank you, madam.
Thank you. So, is anybody left out? Did I leave anybody out?
Ma'am, am I audible now, ma'am?
Yeah, you are. You are very
Right.
loud and nice.
Ma'am, I'm Lieutenant Colonel Smita. I'm Dr. Smita. I'm also an Armed Forces officer in AMC. And I'm a PSN specialist, ma'am. I'm posted at Rajasthan, Sri Ganganagar right now, ma'am.
Okay. Very nice. Thank you. Welcome now.
Thank you.
So, as you have seen that this program of IGNOU is very unique because we have people from all over the country, people who have been sponsored by their organization. Some of them have joined, by their own free will. Unfortunately, normally what we have the last dates and then there is an extension of last date, and when there is a problem in joining, then also we are able to help. But this time there was a lot of strictness from UGC side, because of which some people were not able to take admission in this batch. So that's why we could not cater to few of the candidates who, because of the mail going into spam or something, they were not able to join. So no problem, because we have this program every 6 months. So I think they will be able to join in the next 6 months with the next batch. So now, just to begin quickly, because I would want Dr. Ashok also to say a few words. I'll just start my presentation just to show you what IGNOU is, and then he can speak about the student support. Just take 2-3 slides. Is my slide visible to you?
Yes.
Yes, ma'am.
I just put it in the slideshow mode. Yeah. So basically, this is postgraduate certificate. You already know the name of the program. And just wanted to apprise you that, you are one of the students of the largest university in the world as far as the number of students is concerned. And though this is not a very old university, it was established in 1985 by an act of parliament, and its mandate was to offer higher education through open and distance learning. But it has 300 odd programs, even more now, on offer, and the number of students is more than 3.5 million. That's how it is the largest university in the world. And it has been accredited by NAC as A++, and it has NIRF ranking number 1 among all the open universities. It has also been granted 5-star rating by Ministry of Education Innovation Cell for bringing out so many innovation startups from the university. And we have this as the School of Health Sciences, where we have programs ranging from masters to degrees to diplomas and to certificate programs. And also some of the certificate programs are awareness programs, like we have the certificate program in yoga. And we also cater to a very mixed group of audience, ranging from doctors to nurses to health professionals, maybe who are working in the healthcare sector as as health assistants, or as lab technicians, and also to anybody who may be interested in the healthcare programs. We have various interesting programs like geriatric care assistance program. We have a home health care assistant program, healthcare waste management program, which is basically a 10+2 program. Anybody who is interested can join. Now, in addition to the School of Health Sciences, where we house all these programs, we have a massive support system all across the country. And this massive support system is through administrative bodies that we have, which are called regional centers. And the regional centers have a number of responsibilities, which I will request Dr. Ashok to explain in short, because he has to go for a meeting. And thereafter, any questions that you will be having regarding this can be taken up by Dr. Ramesh, who is also regional director in Hyderabad. So,
तूने join नहीं किया?
Am I not audible?
Oh, session is on.
You are audible, ma'am.
Okay, so please keep yourself mute. Yeah.
Okay.
So now I think just this very brief introduction about IGNO, I will request Dr. Ashok to elaborate a little bit about other features of IGNO. We have overseas centers, we have online programs, we are the national coordinator for SWAYAM, which is the MHRD portal for online education. We are also the national coordinator for SWAYAM Prabha. And now I think, Dr. Ashok, I'll hand it over to you to tell a little bit about the student support services that IGNO has and how its network is there across the whole country. Thank you.
Thank you so much, ma'am. Thanks for kindly giving me this opportunity to interact with the students. Dear learners, I welcome you all, and I am very happy to say that now you are a very proud family member of the largest family in the world. Our IGNO, as just described by ma'am, it was established by Government of India by an Act of Parliament, Act number 50 of 1985. And our university started with just 2 programs in 1987, Diploma in Distance Education and Diploma in Management. And the very first batch in these 2 programs was having the number of learners 4,528. And since then, not only the number of programs has increased exponentially, now beginning our journey, academic journey, with just 2 programs in 1987, now our university is offering more than 300 programs, not only in India, but through our various overseas study centers as well. And the number of learners has also grown in a very large numbers throughout the world. We are not only serving the population of India, but we are very happy to say that we are serving foreigners and foreign nationals also who are studying and not only gaining knowledge, but also upgrading their skills through our IGNO programs at international level as well. And the number of learners which we are serving and which we have served all combined together is more than 75 lakhs. So it is the world's largest family, and now you are also a part of our IGNO family, and I welcome you all to IGNO. And dear students, as was just informed by ma'am, that our regional center. Now, this is our regional center. I belong to regional center Delhi 3. And in India, we are having total 57 regional centers, just like our regional center Delhi 3, which is located in New Delhi, Narayana Vihar. And our one more regional director colleague, regional director Hyderabad, is also present in this meeting. So, dear learners, we are having our IGNOU headquarters at Maidan Gadhi Saket at New Delhi. And this second layer, we are working under the guidance and various rules and regulations as established by our university, which are being followed by us at not only at regional centers but also at the study centers of IGNOU. So our IGNOU headquarters is at Maidan Gadhi Saket. Then 57 regional centers which are under direct control of IGNOU headquarters, and there are more than 2,000 study centers in our country, which are spread across all the country, within not only within states, UTs, but everywhere we are having our one IGNOU study center. And we have collaborations with Army and Navy and all other important bodies, statutory bodies. We are working in close collaboration with the UGC, AICTE, and all other statutory bodies which have been established by Government of India, not only to take care of in the education field, but health sector as well. So this is very brief about our university. And as far as our roles and responsibilities at IGNOU Regional Center are concerned, basically we are performing the academic as well as administrative type of work. We are helping our university in getting the enrollment from the field. We are promoting and publicizing our IGNOU programs through our various social media handles, because the students will get themselves enrolled only when they will come to know which programs are being offered by our university. So we are extensively using social media. We are having our Facebook channel, YouTube channel, Twitter, and all other social media handles. So we first and foremost important activity which we are organizing through our regional centers is that we help the learners get themselves enrolled in our IGNOU programs. Then after when the students get themselves enrolled, then we conduct induction meetings for them. And in these conduction meetings, we help them understand what IGNOU is, how does our system work, and how the students can perform their academic journey very smoothly in our university. As you all know that there is a minimum duration of your program and one maximum duration of your program, and your program has various different type of courses. You are having theory courses, then you are having practicals. Some programs are having project and internship components as well. So we help the students understand the nature of their program and their courses, and with the help of our study centers, we organize the counseling sessions for our learners at the study centers. Because as designated study centers, there are teachers whom we call as academic counselors. So with the help of those teachers, which we call as academic counselors, we organize not only theory sessions for our learners, but in the laboratories which are available at our study centers, we help the study centers conduct the practical sessions also for our learners. Then one more important activity is the assignment evaluation. In each theory course, it is mandatory for the learners to write one assignment and submit it at their study center. So we help the study centers to evaluate the assignments, and when the study centers evaluate the assignments of the students, they send us the awards, and then we help our IGNOU headquarters in incorporating those assignment awards into the grade cards of the learners. And one more important activity which we conduct with the help of our study centers is the term and examinations of our learners. And if there are practicals, then we help the study centers to conduct the practical examinations also. So all these activities are being organized by the regional center, with the help of experts available at IGNOU headquarters in School of Health Sciences, as well as with the help of expert academic counselors which are available at our study centers. So you are in very safe hands, and I wish you all the best that you have got yourself enrolled in this program, in this very wonderful program, not only to enhance your skills, but also to gain the current and latest knowledge of the field. And I hope that your academic journey in IGNOU with us will be very pleasant. And we are always at your disposal. We are in just an email away. Whenever you have any doubts, you can send us an email, and we reply our learners within 24 hours or max 48 hours. You will be getting your queries resolved. So this is the brief introduction of our university and brief about our system, how do we work in our university. So once again, I welcome you all to this largest family in the world, our IGNOU family, and we are very happy to have you with as our not only as our students but as our esteemed colleagues. You all are our colleagues, and we will be very happy in serving you. Thank you so much. Welcome once again to all of you. Thank you so much. Thanks, ma'am. Thank you.
Thank you. Thank you very much, Dr. Ashok. Despite being busy with your meeting, you joined and you also shared your views and gave a lot of overview about IGNOU. Thank you so much.
Thanks, ma'am. Ma'am, may I leave now?
Yes, thank you.
Okay, thanks a lot, ma'am. Thank you. Namaskar.
Namaskar. So I will now. We also have, you most of you are attached to RNR Hospital. So we have Prasanna Joshi also, who is joined on behalf of your program in charge, who is Dr. Samir. But I will first talk about the program and then Dr. Madhur, and I can request Prasanna, or at that time, if Dr. Samir will join, maybe he can also give his inputs. So I will again share my presentation so that we can go ahead with. About the program. I can just share the program. 1 second. Yeah. Okay. Yeah, I hope the presentation is visible again. So this is why it is an important program. Number one, because we do not have such a program, especially in the civilian sector. And also in the armed forces, you do have orientations, you have sensitization programs of 2 days, 3 days, but you do not have a certified program in which your skills and competencies are tested, that whether you have actually gained the knowledge and the skills that you were supposed to. And for this particular program, we have immense support. We have support from IDS, from DGFMS, from CAPF and DRDE. And this is in the preparation of our course material, in the delivery of the program. And we also have a lot of sponsorships which have been received from a large number of military, paramilitary and civilian organizations. Like we have sponsored candidates from DGFMS, we have from ESI, Reliance, BSF, CAPF, or from even DGHS. We are always having an NDRF also. So we have sponsorship from all these organizations. Now coming to the program, you all know that this is a 6-month certificate program, but there is a flexibility of completing this program in 2 years. Now, although you are going to be considered as the January batch, although we have already reached the end of April, but when you have to quote yourself, you will have to quote yourself as January 25 batch. And because of all these bottlenecks and the difficulties in admissions, which gets little skewed because of whatever administrative reasons, we do allow these students to be able to complete their program in 2 years. So you can, I'll tell you the various components of your program. So the components can be taken up anytime within these 2 years. And the target group, you are all aware that this is doctors, and we only take Indian citizens. So that's why we have to check your citizenship before we allow you this particular program. Now, the objectives of this program range from awareness to kind of, psychomotor skilling you with for certain things, basically to apprise you about the problems and the medical issues related to a CBRNA incident, and also how to handle a CBRNE incident. So we do that by giving you certain mock exercises, by discussions, by some tabletop things, and also some laboratory equipments, and we do show you some kind of some videos, but also live demonstrations, for example identifying a live radiation source and things like that. So basically the objective of this program is so that you are able to comprehend the enormity and complexity of a CBRNE threat from a medical perspective. You should be able to describe the impact that a CBRNE agent has on human health, assess their health effects, and should be able to identify and decide upon what are the medical countermeasures, the detection equipment that can be in place, and the SOPs for the medical management. Also first aid and life saving measures, how they are very different from the normal first aid and life saving, especially if it is a chemical agent, it's very much different. What are the not to do's are as important as what to do. Then you have various competencies on protection, mitigation, and medical management of CBRNE casualties, and also some glimpse into the current R&D initiatives that are being taken up in this area. Now, this particular program is of 16 credits. One credit is basically credit measures, how much time it takes for you to study. So one credit is considered equivalent to 30 hours of learning. That is the amount of time that you will take in reading, in assimilating, maybe doing some assignments. Then you have 3 courses. Sorry, you have 2 theory courses and you have 1 practical course. So in the theory courses, the first theory course is a 4 credit course, which is basically a basic course in which we teach you about interaction to CBRNE threats, basics of radiological agents, chemical agents, and biological agents. I had also sent an email in which I had sent the soft copies of the course material. Were you able to access it? Because I got a response from one student in which he was asking what is the password. There's no password for it. So were most of you able to access this?
Ma'am, it's asking for a
Yes.
password.
It should not ask for a password. Actually, I will again share it, because I had done for to be able to take by anybody who has the link. But anyway, I'll share it again with your email IDs. We also have a web portal, a kind of a website where we place these soft copies of the material. I'll do that. I'll attach to all of you. I hope all of you have Gmail IDs, because that portal is based on a Gmail. So if you don't have Gmail IDs, you can message me or you can mail me. When we form a WhatsApp group, you can also put it in the WhatsApp, so that I'll just now after this presentation write my mobile number in the chat box, so that you can just WhatsApp me in case you don't have a Gmail ID, and then we will send everybody access for that particular website, which will have much more than just your soft copies. It will also have a lot of other things. Then we have health effects and medical management of CBRNE agents. This is the second course, which is basically an advanced course in which you see the effects of the various agents, whether it is chemical, radiological, nuclear, and all. And also you learn about the medical management for the various agents. Very interestingly, also is the last chapter, basically, which helps you to identify or supposedly the agent which could be which could be the causative thing or which has been used. So an unidentified agent, how you have to approach and do the triaging, that is what has been taught in the last block of this particular course. So block is basically a kind of book in which you have about 3 to 5 chapters. Each block has 3 to 5 chapters. And then we have got the practicals. So the practicals, we have 3 practical manuals. One is devoted to radiology and to some extent nuclear. We have chemical and industrial agents in that. And then the third one is biological, in which certain skills have been provided. So you have to undertake those particular skills. We have logbooks where you have to record the activities that you perform. So there will be many of the things which will be done online. So for those online classes also, you have to record whatever is given in the corresponding logbooks. Okay. Now in distance learning, basically we have a program package. So we just don't give you lectures in a convention, like in a conventional system, and practicals, but we give you much more than that, because we realize that this particular program is for it is for adult learners, and all of you have different skill sets, different experience, different ages, and also your different styles of learning. So that is why some of you may want to do a group study, learn with by interaction, discussion on particular topics, whereas others may like to just sit with the book and read and try to find out more by maybe exploring through the other resource materials provided, and others may like to just go through the videos and then work further on that. So that is why we give you this consortium of a lot of things. There is course material, soft and hard, both copies are there. You will be getting hard copies if you've opted for them. You will have videos, you will have online classes, you will have discussions, and you will also have certain lab practicals. And for all the classes that are taken, the material we have, as Dr. Ramesh also, Dr. Ashok also said, you have assignments. These are open book questions actually, but it is for you to actually go through the assignments and then see how well you have understood the course material before you do them. Okay, and then you have got the examinations. We have theory as well as practical examinations. Now this is the material that you should receive. Basically we have actually there are 10 blocks, but they are all compiled into 3 books. So we have got one book for the first course, that is MME 011, and we have 2 books for the second course, that is MME 012, because there are 6 credits, that is we have 3 and 3 blocks in each of the 2 books, and we have 1 assignment per course. And then we have got 3 practical manuals and 3 logbooks. So we do not have the hard copies of the manuals and logbooks. Whatever you will have to do for your logbooks, you'll have to take a printout, and it's in a file in which you can add the number of pages in between if you want to write more. Now, as far as assignments, as I told you, are concerned, all the assignments are compulsory. I mean, there are only 2, so both of them are compulsory. You need to follow a time schedule, and you are required to submit them. I think I made a mistake. I sent you the assignments of the previous year. I will have to resend you the assignments. I'm sorry, I forgot, because I forwarded the mail of last year, so I have forgotten to change the assignments. I will do that. And because there are new assignments every year, they have to be handwritten, and for them, for you to be eligible to appear for the term and theory examination, you should have submitted the assignments. The evaluation is not important, but submission before the exam is important. And then we have got the practical training. So you have already been attached to your centers, so you will have a model training schedule in which you will be taking the practicals. And then we will have online practical classes. We will have recordings of the videos, which will also be posted in the web portal, but not immediately. So that is posted much later, nearer the exam. And so it's better that you attend all the video lectures online, because you can also have discussions. And then you have to maintain a logbook. Now, this is the infrastructure for delivery, which I have been telling you. So we have got the School of Health Sciences in headquarters in Delhi, and where the program has been prepared and from where it is monitored. And then we have the regional centers, as already explained to you. And then we have the learner support centers. So we have 5 centers in the country. One is in RNR. We have AIMS Jodhpur. We have AIMS Bhopal, AIMS Rishikesh, and NIMS Hyderabad. So you must be knowing all this, because when you applied for the form, then in the form all these 5 centers were given. These are some of the core competencies that we will be teaching you in this particular course, just listed here for just a kind of a overview or a reference, peep into the course. And of course, this is important that your logbook is most important. You must carry it throughout your posting. You will be having a 4.5 days of contact session. So that will be somewhere done, maybe either in the month of, I think probably in July, because you will be having your term and examination of theory in the month of June. Now, the point is that the theory term and examination last date for submitting the form for this June is tomorrow. But generally speaking, for a certificate program, when the students join, because the joining is so late, then very few people generally apply for the exam. But if you feel, after going through the course material, you feel that you will be able to appear, or you are confident that you can appear, you can fill the form. Otherwise, you can take the exam in December. So you will get 4 chances: this June, coming December, and next year, June or December. You can take these exams in these two, any of these 4 semesters, or you can call these sessions. Again, assignments, as I told you, I'll be sending you. You can give the assignments and submit them. You can submit them by 30th June also, because there is a provision when you write fill the form, you have to tick that I have submitted assignments. So because you have joined late, you can tick that and submit by 30th June. Because if by chance you have ticked that but you have not submitted when your papers result is being declared, then your result will not be declared. So please tick only if you're confident that you will submit the assignments. Otherwise, maybe for the next session you'll have to take the new assignments. If you can do your assignments till 30th June, then you can go ahead and do these assignments, because once you have done the assignments, you can still sit for the exam anytime. I mean, assignments once submitted, you don't need to submit again. So you can sit for the June exam, for the December exam, or the next year exams, but assignments once submitted will be counted as submitted. This is just to give you an overview that for all the theory component, we have an internal assessment and term end, and for practical also, we have an internal assessment and term end, and 50% is the cutoff pass percentage for each of the component. That is, whether it is assignment or it is term end, you have to separately pass each component. This I have already told you, and 3 hours exam will be there. And for the December examination, you will have to submit your the online examination form by 30th of September. June session 30th March is written, but they had extended it to tomorrow. So they may extend, I'm not very sure, because that is handled by the evaluation division. It's across all courses. And this is the term and practical examination. This is also held twice a year. Now for the practical examination, one thing is important, that it is held in your the practical examinations and the learner support center, where you will be going for your practicals. So you will do your practicals for 4 days, and on the 5th day you will be taking your exam. Now we only schedule the contact sessions and practical examination if there are at least 5 students, because of the cost effectiveness. So even though you may be attached to, for example, Rishikesh, but if you don't have enough candidates, then we will give you a choice wherever the exam is being held, whether it is Jodhpur or it is RNR, wherever. Then you can choose whether you want to take the exam at that time or you want to wait for the next session. So that is also possible. And of course, you can contact me, you can contact the regional directors, you can contact also the coordinator of the learner support center, and also the respective divisions. Like I told you, the material distribution division, we have got the evaluation division, the admission division. It's all looked after by different things. So this is all that I have to say about the particular program. But before I go ahead, I would also like to show you certain things on the IGNO website. So I may not be able to show you everything, because what happens is that nowadays the new website has come, and it opens into a new window. Let us see what all we can see. So I will just share my screen with you. Please let me know if things are visible. So can you see the IGNO website?
Yes, ma'am.
All of you have applied through this website. So now one of the first issues that you will have will be that about your material distribution. So if you just scroll down the website, you have this blue ribbon in the end. Are you able to see the blue ribbon in the end? So this is your study material status. Can you see this study material status?
Yes, ma'am.
So you click this study material status, and then over here, according to your registration, you can see over here the January 25. So you click this January 25, and now that is the issue which happens. It will open into another website. Now when it opens into another page, then you have to just fill in your ID number. I'll show you in a second. But before we go ahead, I want to show on this page again, you have check your registration status. The first thing that you should do is click on this to check your registration status. Now, I don't think you can see what is opened. Can you? No. So what I will do is I will again share this now. So can you see this? page? Know your admission or registration status?
Yes, ma'am.
So over here, you will fill your enrollment number. So anybody, can you share your enrollment number with me so that I just show this page? Anybody can tell their enrollment number?
2501
2501
901
901
936.
936. Okay, then you just select the course. So your course is PGCMDM. You can see the number of programs. PG. Yeah, here we have PGCMDM, and then we put the verification code 1313 and we submit. So can you now see? Okay, this is Dr.
My name is Dr. Sujit Singh.
Sujit, your enrollment number is here. Okay, so you get your enrollment number, and then over here you please check whether your father's name is correctly printed, and especially your address, because your degree will be sent to your address. So please check. Sometimes this may be wrong, and then you will not get correspondence your degree. So this is one thing that you need to check. After this, over here already you have got that you have been given 3 courses, so nothing to check in this. And of course over here then you have other things, so you can check your term end result from here. You can check also your material status from here. I showed you the other window, but you can also check over here. When you have fill your form for the term end examination, then 1 week before the examination the hall tickets are available. That also you have to download from this particular page. Okay, and over here you can check your assignment submission status. So when you submit your assignment, it will come that it has been submitted and received, and your term and exam form submission status, that whether it has been received. In case you are not happy with your examination result, then you can do a re-evaluation over here. And re-registration is not there for you just now, and credit transfer into another program we don't have, so you generally, this does not pertain to you. iCard, this is the old student link. So iCard, I think we will request the admission division to share your iCards, because you're a small group. So that will be done for you. You can go over here to check the previous year's question paper. Now, if you go to this link and open it, this will open in another window. Can you see this window? No.
Yes, now we can see.
Okay, so over here you have got all these previous years question papers. So when you click over here, you just write MME. Please, and somebody is not mute. Please mute yourself. So, okay, this is not coming like this. So we will do PGCMDM. Yeah. So over here we have PGCMDM. And we do not have anything in this. December 23 is not uploaded, it seems.
Ma'am, it's uploaded. You have to click on December 23.
We have to click on this. Okay. Yeah, here. Okay. So we have PGCMDM here, and it is uploaded here. So you can open and you get the previous year's question papers. All right. So this is about that. Now coming over here, you have one as student services, and we have this thing, and I think that's about all, because even the results you can see from there. Then of course we have an alumni portal. Once you clear your program, we will request you to join the alumni. So I think this is all I would like to now say. Nothing more from my side. Anything you people would like to ask? And before that, I think I will first of all request Dr. Ramesh if anything I have forgotten, so he can just add. Dr. Ramesh, would you like to say something?
Thank you, madam. Thank you very much. Esteemed Director, School of Sciences, and fellow Regional Director from RCA, New Delhi 3, and dear learners. So the presentation in our induction program is very comprehensive and very in detail. and it has been dealt so minutely also. Now that the examination is just in the month of June, I hope the learners will respond and immediately register, today being the last date. And the assignment schedule and the examination schedule is already available on the IGNOU website. And the induction program is really empowering, madam, for these learners. And we hope to see these learners take the advantage of this induction program and see that they are going to complete their program so successfully. We thank all of you for joining, and we sincerely thank our program in charge at NIMS, Dr. Mathur sir, for his excellent support and guidance to our learners. And we look forward for registration of many more programs for these learners. Thank you, madam. Thank you very much.
Thank you, Dr. Ramesh, for always being there and supporting all our students. So now, though we don't have from this batch any student who is enrolled under Hyderabad, but I would like Dr. Madhur to say a few words regarding how the program, actually takes place. What are the activities that are performed in a learner support center? So, Dr. Madhur.
Good afternoon, everybody. I'm Dr. Madhur. I'm the additional professor and head of the Department of Nuclear Medicine in Nizam Institute of Medical Sciences in Hyderabad. Actually, this program has been going on for the past 5 years now. We have been conducting. Every year we conduct twice the contact session. And in the contact session, basically what we do is we'll try to simulate, or in MBBS, nobody has any exposure to nuclear medicine. So first the basics, what is there, and then all the radiation instruments which are required, like the radiation monitors, the TLD batches, the pocket dosimeters, all those things, how to handle them, how to use them, all those things are being told. And on the last day, then we have the practical exam. I'll request only those who have enrolled in Hyderabad should send their assignments to me, and rest all, wherever they have enrolled, they should send it there. Thank you.
Thank you, Dr.
No?
Madhur.
Yes, sir. Yeah.
Anybody saying something? Okay. Dr. Joshi, would you like to say something regarding RNR? Hello. Yeah, Dr. Prasanna Joshi. Okay, you're not audible to us. Okay, so no issues. All of you will be, we will have a WhatsApp group and this thing. My one concern is there, because I told you that many students could not join. Now that I'm seeing the admission over here, 2 of you have joined Jodhpur. I do not know if you are here just now. I will just read
I'm
out.
here, ma'am. I'm in Jodhpur. Venkatesh
What-
Anger.
Venkatesh, 1 second. I will just check the name. You have been allotted Jodhpur, isn't it?
Yes, ma'am.
Okay, so now point is, because only 2 of you are there, I'm not very sure of the previous batch who is there. So would you like to shift yourself to RNR for your practical training?
I can, ma'am, but the contact can continue over here for the theory.
Yeah, theory is not an issue at all. Theory will be online. So basically you will only have to come to Delhi for 4.5 days. That's all.
Right, ma'am. I'll just consider it in.
Because you can consider and let me know, because otherwise, we may not be able to hold the contact session over there in Jodhpur if we have less number of candidates. Of course, if we have spillover of the last year, because there were last year about 7-8 candidates, we'll have to check how many of them are there. So if they are there, then there's not an issue. But otherwise, you keep in mind. Who is
the contact person in Jodhpur, in AIMS Jodhpur? Who do I contact?
Dr. Pankaj Bhardwaj.
Dr. Pankaj Bhardwaj.
Yeah,
okay, I'll meet him. I'll go over and meet him, and
you
then
can meet him and have a word with him that what will be this thing. And the other person, 1 second. मेरे को नाम क्यों नहीं आ रहा है आप लोगों का ना इसमें? फादर्स नेम आ रहा है, नेम ऑफ द कैंडिडेट ही नहीं दिया है इन्होंने मुझे. अच्छा, एनीवे, So there is some Nagpal, I think, the second person. I don't think he has joined the induction today. So it doesn't matter, but we will contact him also. I have the numbers of everybody. We'll contact and then we can find out what to do. Okay. So now anybody has any other issues, so please let me know so that we can sort it out here.
Ma'am, will we be receiving the physical copies of the course material soon?
Yeah, you will be, because just now only the admission data has been received by me. So immediately I opened the, did the induction. Now this whole admission data will also go to the metal dispatch division and then they will be dispatching the material.
Okay. Thank you, ma'am.
Yeah, Dr. Sujit.
Ma'am, what is the difference between this regional center and learner support center? Because in my
Okay.
ID card with enrollment number ID card which I have received, regional center is written Delhi, Narayana. And what about the learner support center and where do we
Learn.
need to submit the assignment?
Okay. So see, now regional center is basically an administrative division of IGNOU. Okay. So all the officials and academics people who are there in regional centers are permanent employees of IGNOU. Okay. Now they are basically doing all administrative work for the program. The learner support center are there in medical colleges or hospitals. So your learner support center is RNR Hospital, Research and Referral Hospital, New Delhi. Okay. Over here, you will have to submit your assignment. Dr. Samir Malhotra is the program in charge over there. Okay. So he
Ma'am,
will.
do we need to go there physically submit it or we
No,
can
you
submit
don't
it
need
by
to.
post?
No, you don't need to physically go there. You can post it, but you have to do hard copy assignments and post it. But do keep a copy, scanned copy you can keep, and for your reference in case if you want, you can also go physically. That is not an issue, but you're not obligatory to go physically.
Okay, ma'am.
Yeah, Dr. Sonali, you had a question?
There is a password that is required to open the.
That's what I was telling. I think you were not at that time able to hear. So there should not be a password. I will resend the soft copy links to all of you. Yeah. Anybody else?
Ma'am, Dr. Venkatesh again. Also, we've already received our iCards. I got a printout and
That's
I
good. No
did it.
issue then. That's very
That's
nice. Okay, good. So iCards are very important. Please keep the iCards, because when you will have the term and examination, your iCard must be there with you. Whether you carry your Aadhaar, passport, it doesn't matter. The invigilators over there only want your IGNOU iCard. Okay, so don't think that that can be replicated or replaced by anything else. That's why the iCard is important. Yeah. Anybody else? So another thing, when you are going to fill your term and examination form, then also there will be a place for paying the practical fees. So if you are planning to appear for the contact session in this session, that is, we will have it somewhere in July, August, then you may fill that fees also. Otherwise, you need not fill that fees. You can then, because that fees will not be reimbursed, and that fees will also not be carry forward. So if you have filled that fees, but don't appear for exam, but appear for exam in the next session, you will have to pay the fees again.
Ma'am, before practical, we have to apply for theory itself, or we can attend that practical without before giving the theory exams.
You can attend the practical without appearing in the theory exam. Ideally speaking, you should have read the theory, but as long as you're all adult learners, as long as you have read the theory and you are very confident that because there'll be a viva also, grand viva. So if you feel that you know the subject now, and you didn't fill the form because you were not very sure, and or it was not convenient, the dates were not convenient for the theory exams, so you didn't take the exam, but you are confident to appear for the viva and the practicals, it's fine. But as far as we are concerned, we don't restrict you to take the practical exams if you haven't appeared for theory. So even if you know theory, you can go for practical exams. Okay.
Okay.
And theory you can give anywhere in the entire country. The online examination form, there is the examination centers are in colleges, general colleges, BA, BSc, BCom colleges, and you can fill it anywhere. So if you are going somewhere outstation also, you feel you can take out time and appear for examination there, that is fine with us. You don't have to give the exam in the same state in which you reside or in which you have a center. Anything else? Please go through the program guide which I have shared. I don't think at least that will be having a password, because that's most important. So many of your queries which will come into your mind when you will be going through this program will be sorted out by reading the program in charge program guide. Okay. So can we close the meeting? If there is nothing else, nobody has any other queries. We're anyway going to form WhatsApp group. Any queries you can always put in there. There's no problem. So I'm going to stop the recording.